Our eyelids are lined by roughly 40 oil glands. These glands produce oil that coats our eye, like an oil slick on the ocean, and this helps to keep our eyes healthy. Occasionally, these oil glands can become blocked and accumulate oil. If so, they can become red and swollen and tender. We call this a stye or a hordeolum. The most important aspect of treating a stye is to use hot compresses to help pop open these oil glands. Running a rag under hot water is insufficient as the heat dissipates too quickly. I like bead masks that you can find in the pharmacy. A particular brand is Brooder. You place these bead masks in the microwave for roughly 20 seconds and then place them on your eyes for about 10 minutes. Afterwards, it is normal to find your eyes are very blurry. This is because the hot compress expressed oil and that oil is now fogging your vision. This will clear over 5 to 10 minutes. Hot compresses are the most important step in resolving and preventing a stye. We can also use some ointments, drops, and antibiotics if necessary. If the stye doesn't go away and the oil doesn't release, then it can become trapped and your body will scar off that oil gland. This becomes a lump in your eyelid that we call a chalazion. At this point, medications and hot compresses will not help the scar tissue and it won't go away on its own. So options include: 1. You live with and tolerate it. The chalazion will not hurt your eye or vision, but it can be very annoying. Option 2. I can inject steroid medicine into the chalazion. You will feel a needle stick and some pressure over several seconds. You will be more swollen afterwards and possibly bruised. The steroid injection is white and can last for months, so sometimes you may see some whiteness under the skin. This does resolve with time. Or option 3, I can inject numbing medicine into your eyelid. I then make a small incision in the chalazion and remove the blocked oil and scar tissue. We do this in the office. You will be bruised and swollen afterwards. Unless very large, this doesn't require stitches. So, in summary, option 1, do nothing. Option 2 is inject it, and option 3 is actually incise and drain it. The human body always wants to scar, so you may always have some lumpiness there that you can still feel, but this is a victory if we can shrink that lump by 80%. These procedures are very safe. If we do anything to the skin, even pop a pimple, you can develop bleeding, scarring, and infection. During the procedure, I will control the bleeding with cautery, although you may notice some occasional oozing over several days. I make a tiny incision in the skin plane to minimize any scarring, and afterwards, you will be on antibiotic ointment twice a day for 7 to 10 days to help prevent infection. This area will scab over and continue to shrink over several weeks. You can bathe, just gently blot it to avoid perturbing the spot. Let's find how to best resolve this issue for you.